China's top leaders have warned lower-level officials not to cover up the spread of a new coronavirus that has now infected nearly 300 people. Anyone who concealed new cases would be nailed on the pillar of shame for eternity, the political body responsible for law and order said. The warning came as state media said 6 people had now died from the virus, which causes a type of pneumonia. It's been confirmed the virus can pass from person to person. The World Health Organization, WHO, will on Wednesday consider declaring an international public health emergency over the virus, as it did with swine flu and Ebola. Such a declaration, if made, will be seen as an urgent call for a coordinated international response. China's National Health Commission on Monday confirmed for the first time that the infection could be transmitted from human to human. It said 2 people in Guangdong province had been infected in this way. In a separate statement, the Wuhan Municipal Health Commission said at least 15 medical workers in Wuhan have also been infected with the virus, with 1 in a critical condition. The workers presumably became infected with the virus due to contact with patients. All of them are being kept in isolation while being treated. Where has the virus spread? A total of 291 cases have now been reported across major cities in China, including Beijing and Shanghai. However, most patients are in Wuhan, the central city of 11 million at the heart of the outbreak. The disease was first identified there late last year, and the outbreak is believed to be linked to a seafood market that also sells live animals. A handful of cases have also been identified abroad, 2 in Thailand, 1 in Japan, 1 in South Korea and 1 in Taiwan. Those infected had recently returned from Wuhan. Authorities in many places, including Australia, Singapore, Hong Kong, Taiwan and Japan have stepped up screening of air passengers from Wuhan. U.S. authorities last week announced similar measures at airports in San Francisco, Los Angeles, and New York. In Australia, a man who had traveled to Wuhan has been placed in isolation and is undergoing tests. China is the largest source of tourists to Australia, with more than 1 million people visiting last year. How fast is it spreading? The outbreak was thought to be limited, but new cases have been reported since it started in December. While the outbreak is centered on Wuhan, there have been cases reported in Thailand, Japan, and South Korea. Those people traveled from Wuhan recently. Experts say there could be more cases going undetected. A report by the MRC Centre for Global Infectious Disease Analysis at Imperial College London said, it is likely that the Wuhan outbreak of a novel coronavirus has caused substantially more cases of moderate or severe respiratory illness than currently reported. There are concerns that the virus could be spread by the hundreds of millions of people traveling for Chinese New Year later this month. What do we know about the virus? The virus, known also as 2019 nCoV, is understood to be a new strain of coronavirus that has not previously been identified in humans. It is believed to have originated from infected animals at a seafood and wildlife market in Wuhan. Coronaviruses are a broad family of viruses, but only 6, the new one would make it 7, are known to infect people. The World Health Organization has advised people to avoid unprotected contact with live animals, thoroughly cooked meat and eggs, and avoid close contact with anyone with cold or flu-like symptoms. Signs of infection include respiratory symptoms, fever, cough, shortness of breath and breathing difficulties. Why China? Professor Woolhouse says it is because of the size and density of the population and close contact with animals harboring viruses. No one is surprised the next outbreak is in China or that part of the world, he says. Is it serious? Coronaviruses can cause symptoms ranging from a mild cold all the way through to death. This new virus appears to be somewhere in the middle. When we see a new coronavirus, we want to know how severe are the symptoms. This is more than cold-like symptoms and that is a concern, but it is not as severe as SARS, says Professor Mark Woolhouse, from the University of Edinburgh. The World Health Organization, WHO, is considering declaring an international public health emergency over the virus, as it did with swine flu and Ebola. How worried are the experts? Dr. Golding says, at the moment, until we have more information, it's really hard to know how worried we should be. Until we have confirmation of the source, that's always going to make us uneasy. Professor Ball says, we should be worried about any virus that explores humans for the first time, because it's overcome the first major barrier. Once inside a human cell and replicating, it can start to generate mutations that could allow it to spread more efficiently and become more dangerous. You don't want to give the virus the opportunity.